You are most welcome, ladies and gentlemen, to your power behind the voice on Tuesday Night Anatomy with Daniel Okon. Yes, we are still in the era of anatomy of clinical importance. And my friends, this is today's case study. A 35-year-old woman presents to her primary healthcare provider with a complaint of excessive hair growth on the face, on the chest, on her abdomen, and on her back. She also indicated to her primary healthcare provider that she's been experiencing irregular menstrual cycles of late and was also experiencing acne. Further interrogation by the primary health care provider revealed that her mother and elder sister also experienced similar presentations. So based on this is a case study we have over here. Now the first question is that regarding the excessive hair growth as far as this patient is concerned, yes, what is the clinical term or medical term for excessive hair growth, yes, on this individual's body? My friends, your answer is hirsutism. Hirsutism. Okay. Now, question number 2 is that what is the main thing, the main culprit, okay, that predispose one to suffering from, of course, hirsutism, based on hormone and, of course, receptor issues? And my friends, your answer that I want you to give is that as far as the hormone is concerned, is the increased androgen levels. And what I mean by androgen, I'm talking about testosterone or dihydrotestosterone levels in females. Okay, so increased androgen levels, okay, as far as the hormone is concerned, is the one which may lead, okay, to, of course, this hirsutism. And then, of course, number 2 will be, of course, increased sensitivity by the receptors on the hair follicles, okay, to, of course, the androgen levels or to testosterone or dihydrotestosterone. So there are two main things: either the androgen levels are increasing or the sensitivity by the hair follicle receptors, yes, okay, have also increased. These are the two main things which will lead to these things. Now, please understand something, that even with this individual, okay, having hair in all these areas is a normal thing that we expect to see. But that hair should not be a terminal hair. Okay, now terminal hair is coarse, okay, they are robust, okay, it's highly pigmented, okay. But in the case, okay, these areas, we are supposed to, for instance, the upper lip, okay, like the chin area in females, okay, like on the chest, like on the abdomen, and all these areas, okay, we are supposed to see hair over there. But that hair should not be coarse hair. That hair should be, of course, vellus. And the vellus hair, they are fine, okay, and they are less pigmented, okay. Also understand that if you look at the fetus will also be having some kind of peculiar hair, and that's lanugo, okay. We are not talking about that one. This time we are talking about vellus hair. And whenever we have this vellus hair replaced by coarse hair, and that is the terminal hair, then what will happen is that it becomes hirsutism. Okay, that is one thing that you need to understand over here. Okay, good. Now, the next question for us is that what, okay, are the implications? Okay, what other things? I mean, as in, if someone is having hirsutism, what would be the other things? Okay, presentations that you may also see. Yes, already we mentioned that yes, it's not only hirsutism that this individual was also experiencing some kind of irregular menstrual cycle and also experiencing acne. Now, one thing that I need you to understand is that yes, the irregular menstrual cycle, yes, will also be evident because at the end of the day, the hormonal imbalance is there. And then also understand that whenever this testosterone, okay, affects its effects on what we call the skin, it actually has maximum effect on the pilosebaceous unit. And whenever you talk about the pillow, yes, we are talking about the hair, yes, and then of course the sebaceous unit. So a lot of sebum, the oily, gland activity will take place, yes, to secrete a lot of the sebum. Okay, and then one thing that we understand is that this sebum, yes, can of course, clog and of course, occlude, the pores in the skin, and that will lead to some of these, of course, acne conditions that the patient may be experiencing. But one thing is that these are not the only things that the patient may experience. There are additional things. Like for instance, this individual may have an enlarged clitoris. Okay, so clitoromegaly, yes, could be a common finding with someone with, of course, hirsutism. That's also a common thing that we find. Also understand that, yes, I've told you times without number, that testosterone is the hormone that is responsible for libido in both males and females. And so when you have such a condition, what we are going to say is that this individual is most likely going to have what we call increased libido. That's also another thing. And also understand that once your female sex hormone, the estrogens, okay, they are down, but rather you are having high levels of testosterone, then of course there could be that kind of fertility, issues. And my friends, even virilism could manifest in here. Saying that because we have high levels of testosterone, then what will happen is that, by way of, externally, the secondary sexual characteristics that we see in males, the female will be manifesting it. So especially talking about deepening of voice, okay, it could be one of the things that you may see. Yes, you may be seeing that this individual may also be having a lot of muscle mass, okay. These are some of the things that you may be experiencing. Okay, so these are some things, okay, some other implications that, or some other things, some other manifestations, okay, that come with, of course, this hirsutism. Now, the next question is that based on the history of this patient, what is the most likely cause of this individual's hirsutism? Now, please understand something, that if you look at hirsutism, if you have a female, like in this case, the individual is 35 years old in her reproductive age, okay, could give birth, okay. If you have such individuals, what we say is that 5 to 10% of the population will have hirsutism. Okay. Now, also understand that yes, postmenopausal females may also experience hirsutism for the reason that yes, the estrogen levels will also go down. So there could be that because of that, hormonal imbalance. There could be hirsutism, even postmenopausally. So if you look at all females, yes, by and large, what will happen is that up to 40% of them, once in a lifetime, okay, may have what we call this hirsutism we are talking about. And so it means that it's a common thing that females, okay, may experience. But based on this individual's, by way of the history that the mother having it, the elder sister also having it, then it is more suggestive of polycystic ovarian syndrome being the male culprit. Okay, the reason is that if you look at, all individuals with hirsutism, about 3/4 of all cases, yeah, may be due to this kind of polycystic, ovarian syndrome. And you know that individuals with polycystic ovarian syndrome, one thing is that they may also have insulin insensitivity, so they may be presented with some kind of diabetes and all that. Okay, there are other things which we may look at that one later. But as far as this case is concerned, then one thing I need you to understand is that the hirsutism is most likely due to, of course, this polycystic ovarian syndrome. But also understand that it is not only, okay, the ovary that is responsible for production of androgens. Now understand that if you are a female, the predominant hormone will be estrogens, okay, produced by, of course, mainly the ovary. But in addition, you may also have small amount of testosterone or dihydrotestosterone as an androgen produced by, of course, the ovary. And that is why I said that we need that one for libido. Okay, so the females also need it. And so this polycystic ovarian syndrome, yes, could be one of the things which can lead to increased production of what we are talking about by way of testosterone or dihydrotestosterone. Now the other thing is that there could be additional things. For instance, there could be a tumor, okay, of the ovary, and it decides to produce a lot of, let's say this time around, you decide to produce a lot of, testosterone, it could lead to some of these things, okay, and neoplasia in that sense. Now, the other thing that I need you to also understand is that it's not only the ovary that may produce some androgens, but even what you call the adrenal cortex, specifically we're talking about the zona reticularis of the adrenal cortex. That one is also responsible for producing what we call adrenal androgens. Okay, and these adrenal androgens, what will happen is that if they are produced in excess, so for instance, if there's a condition like congenital, adrenal hyperplasia, okay, say that the adrenal cortex, mainly the zona reticularis, may produce a lot of adrenal androgens, then one may have this hirsutism that we are talking about, okay. And one condition also, like the Cushing's syndrome, okay, is also one of the things which could, yes, indirectly, yes, it could contribute to, of course, this hirsutism. Understand that whenever you have Cushing's syndrome or Cushing-Boyce syndrome, then there's an issue with, of course, this time around, the zona, okay, fasciculata, okay, of the adrenal cortex, this time producing out of glucocorticoids. Essentially, I'm talking about cortisol, okay, and that one could indirectly result in, some of these hirsutism that we are talking about. Okay, so there could be other medications. There could be, yes, some steroids, okay, that one may take, which could also, yes, potentially predispose one to suffering from this hirsutism we are talking about. Now, the next thing that we need to also look at is that, yes, what will be the main thing, okay, that we need to do by way of the management? Yes, one thing that studies have shown is that through exercise, physical activity, trying to reduce your fat level. So if you are obese, then the chances of getting hirsutism, yes, goes up. And so regular physical activity could help in that regard. Yes, there could be other things which may, of course, block, by way of, talking about the receptors or the production, excess production of androgens. Okay, so anti-androgen medications could be given. Okay, yes, I don't want to mention those names, like even some what you call diuretics could even help in that regard. And then one more thing too that you need to understand is that you may also, okay, yes, take away, there could be that kind of intervention to take away excess of these hairs which are produced in all these areas. Because one thing is that whenever someone has this excess, hair on the body, okay, yes, emotionally, we are talking about the anxiety, we're talking about the emotional stress, we are talking about depression over here, okay. All these things, could be one of the things that immediately one may seek, medical help, okay, to try and, of course, resolve, this issue. My friends, I believe you find this meeting helpful. I'm very grateful for your time this evening. Have a good night, all of you, and may the good Lord richly bless you. Amen.